Okay, so in this segment, we're going to talk about vertigo causes. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner here in Reno, Nevada. This is Dr.
Randall Gates. I'm a board-certified chiropractic neurologist.
And together we run a kind of integrated, natural, non-drug practice treating chronic conditions and diseases. I think that's all the proper buzzwords, but that is what we do. And we like to share with you in these snippets things that we have found, things that work, new research. Dr. Gates is particularly excited about spending lots of his time researching. I'm glad he does, because I don't. But the bottom line is to try to help people to sort out the confusion that's going on out there. I will say this: Dr. Gates has a particular interest in vertigo, dizziness, balance, and migraine problems. This is about vertigo. I say that because you're a board-certified chiropractic neurologist. Dr. Ted Carrick should be given credit for putting together the certification program. It is massively comprehensive. He is probably most famous for getting one of the most famous hockey players back on the ice in the NHL a couple of years ago, after this guy had been everywhere and spent God knows how much money not getting any results. And so he made his mark really doing vertigo, dizziness, balance, and migraines. That's how he made his mark. Dr. Gates studied under him and has been studying different nuances and aspects of vertigo ever since. We get pretty good. We get really good results. We get really good results with vertigo for that reason. So I'm going to ask Dr. Gates to share some of the new stuff that he's talking about. Maybe go through some of the basic causes and then some of the new data that you've been researching over the last couple weeks. Last couple weeks.
So vertigo basically means when there's an illusion of movement. Usually it is designated where the room is spinning around you, or the room is really tilting pretty quickly, and it can be due to a variety of conditions. It can be due to problems in the inner ear itself. It can be due to problems of the vestibular nerve, which is the nerve that transmits the motion of our head and our body relative to our surroundings. It can be involved with the blood vessels to the nerves from the inner ear. It can be involved with multiple sclerosis. It can be involved with tumors or strokes involving the brainstem. It can be involved with seizures, just to name a few. It can be involved with autoimmune conditions affecting the inner ear. And that's really what we're going to talk about today. If you want a more detailed explanation of the causes.
Or the ossicles. You got to mention BPPV, because that's what everybody is told that it is.
BPPV, the first BPPV, where we get calcium carbonate crystals that dislodge from a certain part of the inner ear, go into the little canals, and when you move your head, it causes the fluid in the canal to move, and therefore your eyes move as a reflex, and you get vertigo.
And that's what it's diagnosed as most of the time.
Right. And if you want a more detailed explanation of the causes of vertigo, you can go to powerhealthtalk.com. A couple months ago, we did a full half hour on all the causes of vertigo. Today, though, we're going to talk about some new literature relative to the vertigo world, and it comes actually from Clinical Endocrinology in 2014. Where they are saying that upwards of half of Hashimotos Thyroiditis patients, I'll explain that, have vestibular dysfunction. So Hashimotos Thyroiditis is an autoimmune condition against the thyroid, and many times it may result in frank hypothyroidism, where a person may feel sluggish and fatigued, and they start to lose their hair, and they start to gain weight and things of that nature, and they may need thyroid medication to get through their day-to-day activities and feel better. However, oftentimes Hashimoto's thyroiditis also will result in just immune dysfunction against the thyroid, and the person won't have frankly abnormal thyroid functioning tests, meaning their thyroid hormones are still normal. Now, the reason why this is so important is because looking at the literature relative to things like Menieres Disease, which some of you may have, that's where you get roaring in the ear, you get ringing, you may have hearing loss, usually low tone, you'll have a sense of fullness in your ear, and it can be associated with debilitating attacks of vertigo that can last hours and are associated with vomiting. The literature on Menieres disease is such that it's so cool to look at it, to go back in time, because when I first got into practice, they were saying, oh, maybe 16% of Menieres patients were autoimmune. Now the newest literature is saying we think either directly or indirectly most Menieres patients have an autoimmune or allergic cause to their condition. And so I just wanted to bring up this article out of clinical endocrinology on thyroid patients because it's so exciting. Here there's...
Well, again, it's exciting because we've been doing this for a while, and we've been treating thyroid patients, and we get a Menieres patient, and we find out that they have Hashimoto's.
Right.
And then we treat them for Hashimoto's, and then their Menieres gets better.
Right.
And it's kind of like, but the literature is not saying anything about this. So you got to understand, folks, the literature that we cite to let you know that when possible, that there is scientific support for everything that we're saying, okay? But the reality is the scientific support usually comes long after the clinicians have some sort of an experience, a result, and we start treating. When we treat people for Hashimoto's, we're actually treating their immune system. I can even take that one step further and say, when we treat their immune system, we usually start in the gut. So we treat their gut, their immune system gets better, their Hashimoto's gets better, and their Menieres gets better. And then Dr. Gates pulls up these articles that says, this is the cause of Menieres like 50% of the time.
Or the cause that, basically they're saying that half of Hashimoto's patients have vestibular dysfunction, which is huge, because that may be associated with Menieres patients.
Have problems that will cause one of the many types of balance dizziness, and in this particular case, vertigo issues.
Exactly. And
thyroid.
And the Menieres literature started exploding relative to autoimmune problems because they started seeing, well, this Menieres patient, just like we observed, oh, they have rheumatoid arthritis, oh, they have lupus, and this is happening at a more frequent rate than should be expected. And so that's where the autoimmune hypothesis came from with Menieres, and then it's since expanded through direct observations of other autoimmune diseases, or, for example, giving Menieres patients corticosteroids and seeing other signs of immune dysfunction and them improving. So, in essence, we posted this article out of Clinical Endocrinology to our Power Health Facebook page. It's pretty interesting, and in essence, again, it's just saying that the immune dysfunction against the thyroid may be causing dysfunction in the inner ears as well, and causing vestibular damage in the inner ears. And we have a lot of Hashimoto's patients even who complain of vertigo and dizziness, just as you said.
Yeah, that's not why they came in here.
Exactly.
They came in here for multiple other symptoms, but that was one of them.
Exactly.
Treat that, and the Menieres gets better.
Right. Treat the cause of the problem in essence. So thank you for watching. If you have any other questions, go to powerhealthtalk.com. Go to our Facebook page. Was there anything else you wanted to say?
No, I think I got my point across.
All right. Thanks for watching.